Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert here, and I am here with my very, very excellent, less nasally swollen co-host since she has now passed over a year for her rhinoplasty, and she will not be requiring fat grafting to the nose.
Yeah, I think that's the best introduction I've ever received. Yeah, that's me.
So that's you.
That's me, Dr. Millicent Rovelo here, all of the above.
A non-fat grafted nasal patient.
Non-fat grafted nasal patient. And that is the topic of today. We are talking about fat grafting to the nose, which is a very niche topic, a very specific place to place fat, and not something very commonly or historically done. So let's get some background about just the basics of fat grafting. What is fat grafting for the uninitiated?
Well, it's when you remove fat from some area of the body and then you place it somewhere else. Anytime you take tissue
From the same person.
From the same person, right? It has to be yourself. We haven't quite gotten to fat transplants as of yet.
Oh, if only.
If only.
If only.
How many donors would we have?
Around the block.
I'd sign up. I'd be like, I'm
Like
here
yesterday.
to donate. How much do you need? Take it away. Go. But yeah, so fat grafting, anytime you take tissue from one part of the body and put it somewhere else, it is a graft of some sort, like a skin graft. You take skin from the thigh, put it on a burn on the arm, that is a skin graft. Fat grafting, you take fat from some part of the body, put it somewhere else, that is now a fat graft. And so fat grafting to the nose is pretty specific, and the reasons why we do it are even more interesting and probably not something that a lot of people are going to come up against. But if you're a patient who needs fat grafting to the nose, you're going to be really excited to hear why it's been great. And I've been doing it now for a lot of years, and it's made a huge difference. Basically for my revision rhinoplasty patients. You know, if you're a primary rhinoplasty patient, you're not going to need fat grafting.
You don't need this. And fat grafting is really, we use it everywhere for very, very many different applications. But fat grafting really has two components to it. One is the volume that's being added. So fat grafting to the butt, fat grafting to the breasts, fat grafting to the face. A lot of these things are done to provide volume enhancement to varying degrees. But another property of fat is its regenerative properties. So it's bringing in, not really stem cells, but growth factors, and it's really stimulating the place that it's being put, the wound bed, to improve the wound characteristics. So increased blood supply, increased collagen, increased elasticity. So we use it a lot for radiated tissues that have just been knocked clean of all of the good stuff. So there's a couple reasons we do fat grafting. One is just for volume, to make things perkier and bigger, but also a lot of times for its regenerative value on its own.
What's your favorite place to fat graft?
Oh, well, the breasts, obviously.
Yes. It works really well for breasts.
It works great.
Yeah, I mean, breast fat grafting is like it has just changed the game, especially in reconstruction.
Especially in reconstruction. And you know what? And the face. I do like it in the face. I think in the right patient, in the right place, it works really well.
So, yes, fat grafting to the nose is something that comes up for me a lot when I see these very burned out, multiply operated, scarred in noses that the tissue just looks like wood. Mm-hmm. And
it feels like wood.
It is. It's woody. It's really like thick, and it doesn't have a spongy quality to it. It's just, it seems like scar. Yeah. So that is where you get a real opportunity to make things better by fat grafting.
And what are you using it for? Are you using it for the regenerative properties or for the volume, or both?
I am definitely using it for both. Like the last patient that I did, she had, her nose was just foobar, like in a lot of ways. It was just awful. And they had done everything wrong to this nose. And there were dents in the skin, and there were stuck areas that it just was terrible. And I said, I need to do a round of fat grafting just so I can get space to open the skin of the nose, to get it off the cartilage and have some place to dissect and to have some blood supply reliability. Like, I just thought the nose had been like run over, stepped on, beaten down with a mallet and thrown into the dumpster and set on fire. And then it's like, okay, so fix it. And I'm like, with what? What am I fixing this with? So the fat grafting that we did was it was only a total of about 6 cc's of fat. Because the nose isn't huge.
It's not huge. That's very little, yeah.
Yeah, so I wound up harvesting about 30 cc's of fat, processing it down, making it into nano fat, by basically passing it through some devices to break up the size of the fat particles, basically.
Make it almost like it's like a puree.
Yeah, basically.
Imagine like a mango margarita.
That's a good.
That's what it looks like.
It sounds great. I would love a mango margarita.
Up my nose, please.
So then we use these very fine cannulas called Coleman cannulas that Sidney Coleman invented years ago, and we were able to introduce the fat into these very stuck areas, a little bit by, not just passing the cannula, but a little bit of subcision, which is where you cut through that scar tissue, open a space, and then fill it with fat. And it does two things. Yes, it provides some spacer or some spacing area, some volume into that area, but it also brings in those regenerative qualities because you are, bringing in, I think my co-resident Adam Katz would definitely say that there are stem cells in that fat, and I don't think he's wrong, but that's not necessarily what I think is doing the job. I think there's also platelets in there. There's also plasma. There's also actual fat cells that do things to their surrounding tissue for survival. And fat can really survive a long time because it is fat. It is a slow metabolizing tissue. It definitely will be able to work to get its own blood supply. And there aren't that many cells compared to the amount of volume because the cell is, little tiny little piece of the cell. And then there's a big lipid oil globule that's there. And obviously when you make it nano fat, there's less of that. But still, the fat cell will then take up lipid and start to make itself into a fat cell, fill the space that you've placed it into, and help to regenerate the area just by its presence there. And whether it's a stem cell that says make more of this or make more of that or bring in the blood supply, nobody has studied it enough. They can tell you whatever they want. They can give you whatever story you want to hear. We know it's good. We know it does work. I see it work. My operations get better because of it, but I can't give you this big scientific play-by-play explanation as to why this is the most awesome move. But for me in these very burnt-out revision rhinoplasties, which I do a lot of, this has been a huge winner.
Well, yeah, and we do know it works. We don't exactly know how, I don't think, but we do know that like if you take a sample of tissue that's been burned out, radiated, destroyed, caught on fire, and put it under a microscope, there is a paucity, there's a lack of blood vessels and connective tissue. You inject fat into that tissue and then take that same tissue and put it under the microscope again, you see new blood vessels growing into that space. You see new collagen fibers. So something in that fat is causing this growth of new healthy tissues. So when you do the fat grafting, which it sounds like you're doing in a staged fashion, you are setting yourself up for success with your future operations.
Correct, because what I'm going to do then is I will come back to do the revision rhinoplasty basically 4 months later, 5 months later. Longer is better, but usually, the patients have, they want to get.
I came for a nose job,
yeah,
doc.
let's go. I got this fat grafting done. Chop, chop. I need my nose fixed. That's why I'm here.
Yeah.
So they have to be patient. I like 4 months as the minimum. 6 is nicer. 7 would be great.
I like
but,
6.
It's like they want to go.
They want to go. And you usually just do one round?
Typically one round. And then I'll also tell them, by the way, we'll be doing this after I fix your nose because your skin is FUBAR, as I mentioned earlier.
So
and for those, if you don't know what FUBAR is, just
look it up.
Google it, Urban Dictionary, please.
Look it up.
It's not difficult. That term was featured many years ago in the Saving Private Ryan series, which I thought was very, very cool.
All right.
So, yes. And by fat grafting after the procedure, now you can really kind of sculpt the soft tissue. It's really nice. And this is why as I am on in my career here and teaching a lot of people revision rhinoplasty, I tell the other surgeons and I explain to the patients, you're going to need to think about this as like a staged set of operations. You can't sit there and say, I want you to knock it out of the park in one operation.
No.
When 8 operations got you here.
Right. Yeah, think about that.
Like the other 7 operations were designed to fix what happened at that first operation that you're not happy about. And again, there's a question always comes up, like, when do you say, like, you can't have surgery anymore? Like, that's enough. You're done. Like, you've ruined your nose. Time for a transplant. And, I think when you start getting into the 7 and 8 rhinoplasty category,
Yeah.
I start going like, I'm not sure this is going to help you.
Yeah.
I do. I can do a lot. I can do a lot of things. And there comes a point where it's just like, this hasn't worked out. You've gone to other people that knew what they were doing, especially after the first one gets jacked up. Then the patient starts going like, well, I'll go to this person. Then they start to do some research. And they usually go to good people, and it still doesn't turn out. So it's like if it hasn't turned out, maybe this just isn't going to work for you. So I don't know if it's 8 operations. I don't know if it's 7. I don't know if it's 10. I had a guy who had 14 operations, and I made him better because it was very designed, specific. Like, this is what I can do. I can add here. I can make this better. But your nose will still look like this nose, but a little better. I couldn't fix the soft tissue. It was over. It had been demolished. And really, the only thing that could have made him a new nose was a forehead flap, which is where you take the skin of the forehead and peel it off the forehead, turn it down onto the nose, and resurface the whole nose. That is a very big deal. That's common in cocaine noses, cancer operations, trauma. We took care of a guy who had his nose bitten off by a pit bull.
Yep.
And I don't want to shame the pit bull population. Everybody always says that you're breed shaming. I'm not breed shaming. It happened to be a pit bull that bit his nose off. I've seen Cocker Spaniels bite noses off on little kids and trying to kiss them and things like. There's no breed shaming. But if you get your nose bitten off by a dog, the truth is that the only way you're going to replace it is with a local flap, and a forehead flap is very effective. So what that is to say is that for these patients that are so far gone, they usually aren't going to sign up for a forehead flap to fix their rhinoplasty that went awry, but some do.
Or they might sign up for fat grafting.
Fat grafting is a good first step for those burned out noses. It's a good first step when you're in a lot of trouble in terms of the soft tissue, and I recommend it. And it's not simple for those surgeons who are listening to this and saying, I think I've got a nose, I need to fat graft. There is a little bit of nuance to it. Smaller volumes are better. Don't go for broke, because you can compromise the blood supply by trying to put too much fat in.
Yeah, that's a very tight space.
Yes, it is. And it's very scarred. It's really not, and it's not good scar. Like, when you're picking up an old abdominoplasty flap or something, the scar tissue kind of cooperates with you. Nasal scars do not. They're usually disorganized. There's a blend of very fibrous tissue with, cartilage and remnants of grafts and things. It's a mess.
Yeah. Well, thank goodness there's you to do the fat grafting and the 15th revision rhinoplasty.
I don't recommend that. Don't get to that point. Find an expert before, like, when you need a revision rhinoplasty, this is the truth. Like, I think if you have a primary, this is just a little recommendation. If you have a primary rhinoplasty and it doesn't go well, and there are things that can be addressed by the operating surgeon, you should have them fix those things, especially if they're minor. If it's I could use my tip up a little bit more, or I could do this, or it's a little bit to the right, can you move it to the left? Yes. Minor revisions by the operating surgeon are best done by the operating surgeon. And if they look you in the eye and say, I got this, then you should try that. Now, if you need a revision rhinoplasty by your operating surgeon and that revision doesn't go well, then there's probably time to start saying, I think I need to go to a different expert who does revision rhinoplasty, because something is wrong. Like, I had the rhinoplasty, it turned out, B-. We went to go get back to the B+, A- category, and now I'm at a C. Well, now you're talking about a time that you got to escalate and look for somebody who's an expert.
There you go.
Does that make sense?
Yes, it does.
Okay. Well, I'm going to go with that. I thought that would be helpful. Well, I think that's enough about fat grafting to the nose, and I'm just happy that you're just not going to need any fat grafting.
I hope, yeah, from your lips. I don't need any fat grafting.
Looks great. Unless you want a fat nose. I don't know.
No, thank you.
I was thinking
Okay.
about a fat nose. If anybody needs fat grafting for a primary, it's me. I mean, you can read the newspaper through my skin. It's so thin, but it's scary.
No, I got plenty of tissue.
You're good. Well, in that case, then, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.